As the field of genetic testing continues to grow and expand, there are more opportunities to learn about ourselves as well as our ancestors through our genetic makeup. While this may seem like a wonderful opportunity for most, it does also bring about some concerns. The topic of our presentation today takes a look at genetic testing and the ethical and cultural considerations in the Native American population. The following presentation will provide an overview of the Native American culture, discuss views on genetic testing, identify ethical principle violations, explain outcomes for patients, health systems, and providers, provide cultural and spiritual implications, and outline impacts to nursing practice by 2020. To begin, let's take a brief look at the Native American population. There are currently 5.2 million Native Americans living in the United States. The Native American population between the years of 2000 and 2010 showed an 18% increase in population. This increase was actually 2 times more than the overall U.S. population increase. When we look at the Native American population, the majority of these individuals live within 10 states, and 41% live in the western United States. Now, with these individuals that identify as being a Native American, they are part of a tribal nation, and there are actually over 500 tribal nations within the United States. Now, let's take a look at the culture and religious practices of Native Americans. As we first look at religion, we may assume that Native Americans all follow the same religion, but this in fact is not true. Each tribal nation has its own customs, language, culture, beliefs, and religious practices, and there is not one single religion that all Native Americans follow. They do believe in a higher being, which they call the Great Spirit. The Great Spirit informs all of the people of life, traditions, and rituals, which are meant to connect the human beings with the Great Spirit. As we look at ethics, values, beliefs, and culture, all of these are passed on through to new generations by using ceremonial practices and also oral tradition. The Native American population uses rituals to help understand and identify their culture. This may include dancing, drumming, prayer, worship, or purification rituals. The intent as they practice their culture and the religion is to ensure that the body, mind, soul, heart are all in balance. In looking at genetic testing in relationship to the Native American population, there are both positives and negatives to performing genetic tests. We will be looking at both sides, and we'll first look at the proponent view. Genetic testing can be used to determine if there's a genetic link to chronic health conditions. We are all aware of the high prevalence of diabetes in the Native American population, and it would be helpful to know if there's a true genetic link or if it is due to the influences of lifestyle and environment. This information would allow for more targeted interventions to address the cause, if it can be impacted, or to identify who should be screened due to being high risk. In addition to a high prevalence of diabetes, the Rapid City Regional Health Tumor Registry between the years of 1990 and 2000 showed a higher percentage of Native Americans with stage 3 or 4 breast, colorectal, prostate, cervical, or lung cancer. This led to the creation of the Walking Forward program, which was the intent was to facilitate access to innovative clinical trials, behavioral and genetic research, and tailored patient navigation. The intent was to decrease barriers to care in this underserved community. The Native American population is a unique population, and this makes them interesting to researchers. This population has their culture, language, and they are isolated from others, which is different than other populations. Finally, genetic testing may be used for tribal enrollment. Currently, an individual must be a descendant or have a relationship with someone who descended from the original list of members. While this does work and the list is based on history, as genetic testing evolves, genetic markers appear more commonly in some populations, and this includes the native population as well. Currently, though, genetic ancestry testing has some limitations because there are only few samples from the Native American population in the current database that can be used for comparison for these tests. Even with these limitations, some tribes have passed an ordinance to use genetic testing to verify new applicants, and this may continue to be an area that continues to grow over the years.
We will now take a look at the opponents to genetic testing in this population. The first view is related to concerns on the use of genetic testing in relationship to migration studies. While the testing may prove scientific evidence for tribal origin, it also may go against cultural beliefs on the origin of the tribe, which have been passed down through generations through stories. In addition, there is concern regarding the collection process of samples, which would either be a swab or blood sample. This may seem pretty basic to us, but for historical data, they must remove bone from a skeleton. This is in conflict with the Native American belief that body parts have spiritual essence and should not be taken. Dr. Frank DePoe, geneticist for the Hopi Laguna Ancestry, stated, "To us, and any part of ourselves is sacred. Scientists say it's just DNA. For an Indian, it is just not DNA, it's part of the person. It is sacred. With deep religious significance, it is part of the essence of the person." There is also a level of concern or just distrust with how the genetic information will be used. This distrust goes back to the time when skeletons were taken from the Native American people, and it was decided they were less intelligent, and this then led to the removal of their lands. This also led to disparity in socioeconomic status, education, and employment. Another issue is unethical behavior and abuse in education, research, and health settings. There are two main examples of this that have been experienced by this population related to genetic testing. The Havasupai tribe in Arizona agreed to participate in genetic research for diabetes. However, researchers went on and extended the testing further than just diabetes without the consent of the people. The testing included tests for schizophrenia, inbreeding, as well as migration. This did lead to a lawsuit eventually, which was found in favor of the Native American population. Another example was when a 9,000-year-old skeleton was found in Kennewick, Washington, which became known as the Kennewick Man. The Umatilla tribe wanted to claim the remains to bury due to their belief. This also led to a trial between the tribe and researchers. The court did rule in favor of the researchers, and they were told not to return the skeleton. What is most interesting is that preliminary genetic tests on the skeleton did indicate that the individual was Native American. Finally, there is a concern about who profits from genetic testing. Genetic sequencing is patented once they are identified. However, researchers are the ones that gain the royalty from the patents, and there is no subject compensation for those that participated. And not to mention, the Native American population does not feel that this is an invented piece of information and that is part of the life form, and so this does also go against their beliefs as well.